Did you know that some diseases can be fatal to dogs if not diagnosed in time? Today, I'll introduce the 10 most common dog diseases, their symptoms, prevention tips, and treatments. Stay until the end to learn how to protect your best friend. 1. Distemper. Distemper is one of the most dangerous and contagious viral diseases, often fatal. It attacks the digestive, respiratory, and nervous systems. Prevention. Keeping vaccinations up to date is essential. Avoid contact with infected dogs and suspicious environments. Treatment. There is no definitive cure for distemper. The treatment is palliative and includes antiviral medications, antibiotics for secondary infections, and fluid therapy to keep the animal hydrated. Symptoms: diarrhea, vomiting, nasal and eye discharge, cough, convulsions, and paralysis. 2. Leptospirosis. Leptospirosis is a serious zoonosis transmitted by the urine of infected rats and other animals. It's common during floods and can infect humans. Prevention: regular vaccinations, rodent control, and avoiding contact with contaminated water. Treatment: antibiotics and fluid therapy to combat dehydration and eliminate the bacteria. Symptoms: fever, vomiting, dark brown urine, jaundice, yellowish skin, loss of appetite, hemorrhages. 3. Parvovirus. Parvovirus is a severe viral disease that primarily affects puppies, attacking the digestive and immune systems. Prevention: annual vaccination and disinfecting the environment, as the virus is highly resistant and can survive for months. Treatment: fluid therapy to rehydrate the dog, antiemetics to control vomiting, antibiotics to prevent secondary infections, and nutritional support. Symptoms: frequent vomiting, bloody diarrhea, fever, lethargy, loss of appetite. 4. Canine coronavirus. Canine coronavirus is a viral disease that affects the intestines, causing severe diarrhea and vomiting. It's highly contagious in places with many dogs. Prevention: keep vaccinations up to date and avoid contact with sick dogs. Treatment: fluid therapy to prevent dehydration and medications to relieve gastrointestinal symptoms. Symptoms: vomiting, severe diarrhea, fever, loss of appetite. 5. Infectious canine hepatitis. Infectious canine hepatitis is caused by a virus that attacks the liver and can progress rapidly, leading to death within 24 hours. Prevention: annual vaccinations and avoiding contact with infected animals. Treatment: there is no cure for the virus itself, but treatment includes symptom management and intensive care to stabilize the dog. Symptoms: vomiting and diarrhea, severe abdominal pain, high fever, lethargy, loss of appetite. 6. Canine respiratory adenovirus. Canine adenovirus causes severe respiratory infections and is highly contagious, especially in environments with multiple dogs. Prevention: vaccinations and maintaining a clean, well-ventilated environment. Treatment includes anti-inflammatory medications, antibiotics, and fluid therapy to keep the dog hydrated. Symptoms: dry cough, nasal and eye discharge, persistent sneezing, fever. 7. Canine parainfluenza. A relative of the human flu virus, parainfluenza is transmitted through respiratory secretions of infected dogs. Prevention: specific vaccination and avoiding contact with infected dogs. Treatment involves cough suppressants, hydration, and antibiotics in cases of secondary infections. Symptoms: dry, persistent cough, sneezing, low-grade fever, loss of appetite. 8. Kennel cough. Kennel cough is caused by the Bordetella bacteria and affects the respiratory system. It's more common during the winter months. Prevention: vaccination against canine flu and proper hygiene practices. Treatment: use of antibiotics, anti-inflammatories, and cough suppressants to relieve symptoms. Symptoms: intense cough that sounds like choking, sneezing, nasal and eye discharge. 9. Rabies. Rabies is a fatal disease that affects the central nervous system. It is transmitted through bites from infected animals, such as dogs, cats, or bats. Prevention. Mandatory annual vaccination. Treatment. There is no cure for rabies once symptoms appear. Prevention is the only way to protect your pet and your family. Symptoms. Extreme aggression or apathy. Difficulty swallowing. Excessive salivation. Anxiety and tremors. 10. Giardiasis. Giardiasis is an infection caused by a parasite present in contaminated water and food. Prevention. Provide clean water and maintain your dog's living space hygienic. Treatment. Use of antiparasitic medication prescribed by a veterinarian and a balanced diet to aid recovery. Symptoms. Soft stools with a strong odor, vomiting, dehydration, weight loss. These were the 10 main diseases that can affect your dog. Prevention is the best way to keep your pet healthy. Keep their vaccinations up to date, maintain proper hygiene, and visit the vet whenever necessary. Did you find this content helpful? Leave a like, subscribe to the channel, and share this information with other pet owners.